What? Come on. Oh my God. What? Unicorn danger, big old spiky bits, and a slide to the left.
It's just a jump to the left.
Today we're breaking down and reacting to all of the creative medical scenes and over-the-top injuries from Fortnite. Let's dive right in. Oh, get out of the way! Oh man, that is awful. We call this a pedestrian versus car. This person is walking across, gets hit on the left leg. Things you think about: femur fracture, pelvic fracture. Then the way that you fall, you think about a traumatic brain injury, head injury, skull fracture, intracranial bleeding. Then you also think, okay, all the lacerations, abrasions, the road rash. What? That looks like somebody's getting electrocuted. You always worry about something called DC versus AC current. That probably is what we call AC current, which is alternating current, which causes flexion of the body. You worry about rhabdomyolysis, breakdown of the muscles, which then can actually clog up your kidneys, which can cause kidney damage. Treatment is a ton of fluids to try to clear all that out, and you got to use IV fluids in that circumstance because you may not be able to keep up with the amount of oral fluids that you need. What? Come on. Oh my God. What? All their limbs just separated from their body, even the head. Typically, when people fall from a great height and land on their feet, ouch, you cause compressive force type injuries. So you can fracture all the way up because of the energy going up. So you think about calcaneal fractures, you think about different types of joint fractures all the way up. You can have blowout fractures in the sense of the tibia fracturing, the fibula fracturing. Oh my gosh. Obviously, these weapons are a little bit different. Taking a gunshot wound to the chest, it depends on closeness, the caliber, the type of weapon you're using. We see anything from subcutaneous tissue injuries to, death. You hit the heart in the right place, you can rupture one of the ventricles or the atrium of the heart and you bleed out within your own chest, or you can puncture a lung and it compresses down so much that it causes decreased cardiac output. Whoa. Oh, what the? Almost reminds me of an onion like slicer, the little device that you can just like chop up onions really fast into quarters. Obviously, totally dismembered. These things don't come to the emergency department. People will have severe injuries on scene to where the injury is not sustainable with life or they're dead on scene. And in the United States, a medical examiner will actually go and take the case versus going to the hospital. Oh my gosh. We'll see nail gun injuries where go into somebody's soft tissue, puncture the lung, or go into the skull. Obviously, we take them out of the hospital, get imaging. Other components of these things, people fall down and they puncture themselves with different objects. The mechanism of injuries are all different, but at the end of the day, it's what underlying structures could be injured, how do you look at it, and how do you fix it? It looks like the thorax, aka the chest. Blood splatter onto the wall looks appropriate. I'm not a blood splatter expert. I think Dexter is from that TV series, which is really good. You can have a single gunshot wound that somebody could succumb to their injuries, or it could be fine. It could literally ricochet off the sternum or the manubrium and deflect off and go into your shoulder or into your arm. It just depends. I'm assuming X marks the spot. So we're seeing blood splatter, but nothing flying off. These injuries, extremities, you definitely have to worry about blood loss and major blood vessel injuries. So if you see an arterial injury, you may actually end up doing a CT angiogram to make sure that the arteries are intact. If a vein isn't intact, it's not as life-threatening in that moment as an artery injury would be. Whoa, too far. Ooh. Whoa. So you get the knee slide. Totally cool if it's super slick, like slip and slide or like ice. But if it's not, you're gonna rip through those pants. You're gonna cause horrible abrasions to those lower extremities, and it might be deep enough that you actually require a skin graft. So be aware of that. Oh, what is that? How is that even a weapon? Laceration, you see those type of injuries in like, say, Mortal Kombat, where they slice through and you see the anatomy, which is quite cool, actually, just the anatomy. But this is probably more blunt trauma, and blunt trauma to the chest. You can actually stun the heart itself. You can go into cardiac arrhythmia just from trauma itself versus causing bruising. And if there's bruising, the tissue is not going to be as well functioning as it should be. So that can cause massive issues as well. What is that? Explosion injuries, we don't see too many of these, obviously. You do worry about, obviously, the initial impact. If you're that close, can it destroy tissue, lose limbs, that sort of thing? Obviously, yes. If you're close enough to it, the compressive forces can pop your eardrums. It can also cause a pneumothorax. Any hollow organ could cause issues. And then any type of burn injuries and lacerations need to be addressed. Shot to the leg. Oh, shot to the pelvis. We actually have structures within the pelvis. Everybody has a bladder in there. Males have a prostate, females have a uterus and ovaries. So different organs within that area, and they're protected by the pelvic girdle, all those bones. But you start shooting in there, there's a lot of major blood vessels that could actually rupture. So you have to be quite careful about that. Oh, what? The head just explodes off.
He's dead.
Oh my. What kind of... That seems like Mission Impossible gone wrong. Belly flopped right to concrete. So compressive force to the area. Obviously, we see blood. Just depends on how high the individual falls from. Skull fractures. You can have brain matter coming out. You can actually go into cardiac arrest. You can have rib fractures, internal bleeding. What happens when they actually come to us? If they're still actually alive, we go back to the basics. A, B, C, D, E. What is this thing? Looks like a mushroom. Whoa, power up. Whoa, what? So I'm thinking Super Mario Brothers, you get a mushroom, you get all like big, get lots of energy. No, this one is like tripping out. There are different types of mushrooms out there. There are good, healthy mushrooms. Mushrooms that, if ingested, actually help with like brain function and energy. But then you have mushrooms like this, where they've changed the vision, and they're psychedelic mushrooms, and they have something called
psilocybin.
It has multiple different properties, and they're actually truly studying this to see if it can help with PTSD and other psychiatric disorders. Oh, what is that? What we see in the emergency department with bugs, insects, we see a lot of people come in with spider bite, spider bite, spider bite, spider bite, spider bite. Spider bite. Did you ever see the spider? No. Could be folliculitis, could be just an infection of the skin area, could be a mosquito bite. But what happens is whatever the bite is, typically it inoculates the normal bacteria that's on our skin that protects us from the environment, getting into our tissue, which then can actually harm us. Other insects that we think about are allergic reaction type stings, such as bees. Not the bees! But you also have to worry about wasps and hornets and the murder hornet. All these other things that can cause not just allergic reaction, but severe reactions to where you become hypotensive and you could potentially die. That water is going to be very contaminated. I've been in bad hurricanes where there's lots of flooding and people swam in that water, and because it's mixed in with a lot of environmental things that are not normally in the water, you increase the risk of different types of pathogens. So please be careful with that. Obviously, swimming, you can definitely float. You can do a dead man float, or you can float on your back to raise yourself to the surface. Okay, we are buoyant. When you're in this type of situation, you want to do your best not to panic, because panic increases the use of energy. You want to conserve your energy. Fortnite actually gave us some very good topics to talk about. I hope you guys really enjoyed this. Check out this playlist right here. Binge watch everything. And also subscribe, turn your bell notifications on, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.